All right, Miss B is a 95-year-old female. She was admitted at XXX. She has no known allergies. Her isolation, she doesn't have any isolation, but she is on fall precaution. Her room number is XX, her team is X, and her code, she's a DNR. For her situation, she presented into the TRU on XXX date. She came into the TRU due to a fall at home while she was cooking due to a grease fire. She fell onto her left side of her hip, which developed significant left pain, and she's unable to bear any weight or move it that much. Upon her admitted into the TRU, they confirmed the imaging to confirm that she has a left periprosthetic proximal femur fracture at the site of her prior hip replacement. And then she then underwent a left revision total hip arthroplasty. Um, um, and now she's back on the unit. Her past medical history: she has an AFib, she has hypothyroidism, and she has osteoporosis. For her vital signs, real quick, temperature is 36.8, heart rate is 112, a little tachycardic, likely due to her AFib and her pain. Blood pressure is 106 over 56, hypotensive, likely due to her being post-op. Respiratory rate is 18, and then SpO2 is 98. So for going down to her systems, her neuro, she's alert oriented times 4, GCS is 15. Her upper extremities, I would give them a 4 out of 4 for left and right. And her lower extremities, I would give the left one a 2, a 2 or 1 or 2, and then her right, I would give them around a 3. Sensations, she has sensations of 4. Extremities, pupils, is Perla. Her pain can fluctuate throughout the day. It can be as high as an 8 out of 10, or it can be as low as a 4 out of 10. But she has PRN oxycodone for that. For her cardiac, again, her heart rate is 112. Her blood pressure is 106 over 56. Her temperature is 36.8. Her pulse is bounding good. Her capillary field is under, it's all good. For respiratory rate, again, she's not on any nasal cannula. She's on room air. Her lung sounds good. Her SpO2 is 98, and then her respiratory rate is 18. Nothing too concerned about respiratory. Her GI and GU, she is currently on regular diet. She does not have any ACHS. Her last bowel movement was this morning during the morning shift. She's voiding just fine. She is, however, on a PureWick catheter, and so check out for that. Her urine is all clear, yellow clear, so it's all good. Her skin, she is a night bath, so she will have to get some bath. For IV, she has an 18 gauge IV in her right forearm. It's patent, it pulls back and flushes, so we're all good on that. She has a left hip surgical incision, of course, due to her surgery. And then she also had a wound vac, but now that wound vac has been removed. And of course, she has PureWick in. But she also have Alevins in on her pressure points, such as her heel and her sacrum, just to make sure that everything is good. All right, so for her abnormal labs, here we have a sodium 131. She has hyponatremia, probably due to she's not eating as much through surgery, and that can increase her fall risk. Her BUN is 18, which is slightly elevated, possible due to dehydration. Glucose is 102, possible due to stress, and she has low red blood count, hemoglobin, and hematocrit, and she has anemia, partly due to her surgical blood loss, which can contribute to her fatigue and weakness, which is why she's not eating that much. All right. Again, for diagnostic, she did a CT on her left hip femur side, and have confirmed that a periprosthetic femur and a soft tissue contusion as well. And there's no intracranial injury in her head after a head CT. Intervention performed. She has currently at fall risk, so again, the call lights when reach, no skid socks is on. Pain management, oxycodone PRN is given. POT and OT and other staff must be there to help her, to move her, or she can't be moved by herself. Recommendation for next shift is to continue strict fall precaution, continue to maintain PT and OT sessions, watch for AFib, can then encourage early ambulation only with assistance. For patient preferences, she avoids codeine co-dying due to hyperactivity. And family, she lives alone, and her daughter's involved.